Hello everybody, how's everybody doing today? Hope you're doing okay. Thank you for coming back and look at my channel. So today we're gonna continue our case management scenario. Today will be a case management scenario 2. So I hope you guys enjoy my last case scenario number 1, talking about how to deal with a teenager who want to commit suicide. So today we're gonna focus on our woman's mental health. So today's scenario will be focusing on the woman who gave a birth to their baby, and then the scenario will be about this woman who suffer and develop mental health issue during the later course of her life. And this is also one of the scenario that I kind of dealt with before. So let's get going and start talking about this scenario. So basically, this young woman who just gave the birth to a baby during the April or May. I believe that was back in 2017. So she came to the clinic and then with the husband. Then the reason that she went to the clinic was because she suffered from severe depression, and then it's not just a regular depression, it's more like a postpartum depression. Means that those type of depression will later be developed into a severe depression during the later course of her life. So after go through a psychiatric evaluation from psychology, and the psychiatrist kind of went through all those different type of factors to determine if this woman will be classified as getting a depression after giving a birth. So they have to do different type of evaluation. So after about 30 minutes consultation, and then spoke with the husband, spoke with the family member, the psychiatrist determined the client does suffer from depressive symptoms. And then those type of depressive symptoms may later develop, if not treated, may become major depressive disorder. So, of course, it is pretty common for a lot of women who develop certain type of mental health symptoms after giving a birth to their baby, because it's very stressful. It's a stressful procedure, and also there is a lot of difficulty involved with that. So as a case manager, you have to determine if a client does have a protective factor. So let me explain to you guys about the protective factor. So how does a protective factor will be helping a client to become more self-sufficient or become more mental health, in mental health wise, they will become more stabilized. So let's look at the risk factor first. So usually the risk factor will be play an important role, because we have to check the risk factor first to see if a client does need to have a protective factor. But for this case, it's pretty obvious. The woman, she came to the clinic and then she's seeking for help, right? Because she developed a severe depressive symptom, according to what she said. So what I did was I kind of list all those questions and then ask her to give me the honest answer. So we find out that she does qualify and she does need a protective factor, because her risk factor including low self-esteem, including unable to protect her baby, according to what she say, including insomnia, including she's not able to eat, lost her appetite, and including that she also feel periodic depressed about her outlook of her future. And also there is a lot of different type of issue that she was going on. She also worry about her daughter's puberty, which means that her daughter is only like 7 or 8 months, but she already worry about her future. So those type of symptoms does display and exhibit that a client does have a risk factor. And then she also worry about a lot of future event that may happen to her, which is not really true. So in order to deal with that, we need to make sure a client has a protective factor. Means that the counselor or case manager, clinical case manager, need to be able to assist the client, assist this woman to build out her self-esteem, to build out her future outlook, to make everything look good. Of course, the husband and the family member need to be able to help out as well. They need to be providing a lot of resource or helping the wife get through the depressive symptoms after her pregnancy. But we also need to take a consideration if at that time we have to make sure to understand how my client, this woman's behavior, this woman's way of dealing with her baby. So our approach goes through a breastfeeding to see if a client is doing a self breastfeeding to the baby. So according to herself and the husband, the client is doing a breastfeeding by herself with the baby. But at a different time, we also need to kind of make sure that the breastfeeding is in the correct procedure, and then make sure that the woman receives enough pump and will be able to release that milk to the baby. So everything seems okay according to my client. She's breastfeeding to the baby, and then there's no indication that there's any issue with that. But for this scenario, I think the most important thing to focusing on is to make sure that the client doesn't have a protective factor, because a protective factor will be helping the client in the very long run. So, and then after all those assessments, we make sure that the breastfeeding is correct. And she went through a lot of menopause, of course, a lot of depressive symptoms, like I mentioned before. The menopause kind of came at a regular time, according to what you say, but her mood has been switched from either very good to very bad. So at some time you have to see if a client does develop some kind of bipolar disorder as well. So the correct procedure for this, once we kind of do a brief diagnosis, brief interview with the client, we find out client did correctly on the breastfeeding. The breastfeeding doesn't impact her mental health. And then we also consult with psychiatrists, we consult with nurses and doctor to make sure this pregnant woman does have a good physical health. And then we also consult with her medication since she developed the postpartum disorder, which may later become a depressive disorder. So we kind of went through that process as well to address all those issues that she may have. So our last procedure with this woman, I asked her to come back to the clinic after a couple months and to make sure that herself and kids also benefit, the baby and herself benefit from the protective factor if they kind of practice those type of things. So the last thing before she left, we kind of talk about coping skill, how to manage her mood on a daily basis, how can she improve her mental health while taking care of the baby, and at the same time did some light physical exercise. So things went pretty well. After a couple months, she came back to the clinic. She was doing well. The baby is well fed, and then the family went back to normal again. So that's it for today's channel. If you do have any question, concern about how to help the pregnant woman after they give birth to the baby, and how to manage their mental health. You can always ask me all those questions, concerns, and leave any feedback under my YouTube channel. Any positive and negative feedback will be taking all the consideration. I will take a look at those questions, and if I can answer all those questions, I will give you the best answer as possible. So thank you for tuning to my channel today, and I will see you again next time.